And then before we start, I just must mention that this presentation is intended for informational purposes only and does not constitute financial, legal, medical, or consulting advice. Please consult with your legal counsel or other qualified advisor to ensure compliance with applicable laws, regulations, and standards. And now for introductions. So I'm actually not Francesca Belmer. She had some power outage go on today. So your host today, I'm Brooke Rohde, Senior Manager of Product Marketing here at Clara, and I'll be your host. For those of you that haven't heard of Clara, Clara is a patient engagement platform that helps consolidate multiple patient outreach tools into one platform while automating key touch points throughout the patient journey. We help practices improve patient satisfaction while also freeing up staff resources so you can get back to providing high quality care for your patients. More importantly, we interface directly with athenahealth for improved efficiency, but we'll get to that more later on. Today, I'm excited to have Jamie Mallinger, General Manager of Clara, here with me. Jamie, would you mind introducing yourself and telling us a little bit about your experience?
Absolutely. Nice to see you again, Brooke. My name is Jamie Mallinger. I'm the GM of Clara. I have had about 12 years of experience in healthcare and healthcare technology, helping practices work more efficiently in order to save time and deliver better care. I believe that great healthcare starts with a good dialogue and a discussion. And I joined Clara about a year ago, and I'm incredibly excited about what we have to talk with you today about, and just generally in terms of the solution that we provide that helps you engage with patients more closely and improve your workflows. And so I hope that you get a lot out of this discussion today, and I look forward to your questions at the end. Great. So I'm going to take over. Thanks, Brooke, for that intro, and we'll see you back here in a couple minutes with some additional add-ons. What I'd like to do is actually give folks an opportunity so that we know who is here to tell us what is your role within your healthcare organization. So just take a couple of minutes or a couple of seconds and tell us who you are so we know who we're talking to. We're going to have a couple of other questions throughout this discussion to keep it a little bit interactive and help us get a better sense of where you're at. Good progress there. We're about a third of the way through. Thank you. Okay. See, we're about halfway there. That's great. If you, the rest of you, can just finish your selections, that'd be wonderful. Great. Okay, we're going to go forward. So let's see, who do we have? We have good selection here. We've got some folks in leadership and practice administration. Hopefully this will be very valuable for you. And appreciate you taking time out of your busy day to join us. I know that your day-to-day work is very heavy, and particularly in today's world. So we appreciate you being here with us. So today, what are we going to talk about? We're going to spend about 35 or 40 minutes talking with you just a little bit about what we have found. During the first 45 minutes, we're going to take a look at who today's patients really are, what they're looking for in their healthcare experiences, and there's some assumptions that we may have, but the data may tell us differently. And then we'll be reviewing some real-life statistics from our patient experience report to understand how practices attract, retain, and satisfy patients, and give you a little bit more tangible examples of what customers and patients are expecting. And the last 10 minutes, we'll open it up for Q&A, and we look forward to being able to address your questions. Importantly, when we think about what it is the basis of this presentation, so the statistics you're going to see in today's presentation are from our Clara Experience Survey, where we went out to about 2,000 patients, and we've compiled everything into a patient experience report that we entitled What Patients Really Think. And to thank you for attending today's webinar, we're excited to give you access to this full report, which you'll be receiving an email following this event. You can download it. And we hope that you get value out of this discussion, as well as, of course, the actual full report itself, which I found fascinating when we put that out there. So look forward to that, and that's where the origin of these statistics we're going to talk about with you today came from. So another poll question for you. So we'd love to just get a sense of where you're at in your level of confidence to accurately understand and meet your patient's preferences. So this is a 3-question selection here. So just read these. You know, 1 is I need to level up my patient experience game. I could use some help in accurately nailing my patient's preferences. That's A. B is I'm getting there. I try my best to understand my patients, how they want to interact, but sometimes I feel like I need a few more tricks up my sleeve. And then, you know, I'm in great shape. I make sure I listen to my patients. I know what they need, and we are tuning our experience to meet their needs. So would love for you to respond and tell us where you think you're at today. And then you can consider that as you go through the discussion today. We're going to give you some tips and tricks. We're going to use some statistics, and some of these statistics even surprised me when I saw them. So I think it's always useful to take stock on where you think you're at and where your patients think they're at. We'll give you a couple more seconds to pick your option and let us know where you stand. Great. All right, let's see. We got about halfway there. Any last stragglers? Go ahead and put your responses in. Otherwise, we'll just move on. All right. So, well, that's typically what we see. We see most people are sort of in line of saying, yeah, I try my best. I'm working hard to understand where they're at. I think I do a pretty good job of this, but obviously there's always more that we can do. I love the honesty of some people that we speak to, and a lot of our customers and prospects that we talk to really recognize that they just haven't had time to invest in thinking about this, and so now is the time. And inevitably, there's always room for improvement. So let's start diving in a little bit more deeply. So who are our patients today? You know, this might be a picture of your waiting room today. And you look at these different folks that are sitting in your waiting room, and you might have some preconceived conceptions about what their preferences are, what they feel like is a good patient experience, how comfortable they are with technology. But it's difficult to judge a book by its cover. And so in our research, you know, we begin to uncover different personas and profiles. So Jane here is 36 years old. She's a stay-at-home mom. She's married with 2 kids, and she's always on the go. And so she needs quick communication when her kids get sick. And so her preference is to communicate via text messaging. So that's a little bit like me. I'd much rather communicate via text versus anything else. But then you have Ben over here, and he's single. He's generally healthy, and his preferred form of communication is web chat or online scheduling. So he's less of a mobile person and more of a desktop person. So he wants web chat. And then John over here, he is retired and he's traveling the world. And he's got some chronic conditions that he's managing. And he prefers phone calls and email. You know, you look at some of the older population, and he may be what we think is prototypical of what you would expect to see in somebody who's a little bit older. But in fact, there's probably an equal number of people that are very facile. My 95-year-old father loves to use text messaging, and he's very tech savvy. So he breaks the mold, but it's important for his provider to know what his preferences are so that they can engage effectively. And then, of course, you know, when we sort of take a step back and we look a little bit more broadly, what are some of the things that we need to be thinking about? You know, what are the communication preferences? How do we deliver quality of care? What is top of mind for these patients in terms of, are they looking for coordination? Are they looking for more empathy? Or do they care about engagement? Right. So all of these things that we need to think about. These are important things to most people, and the trick is to begin to understand what it is that is a particular patient's specific preferences, right? And obviously you don't know until you ask and you engage with them. So that's one of the tricks of the trade, is making sure that you're engaging your patients on a regular basis to understand what does matter to them. So one of the first statistics that we're going to share here is that 73% of patients agree that they keep a mental scorecard of all the things that they like and dislike about a doctor's office. And that was a little bit of a surprise to me. I mean, I know we all care about a good patient and customer experience. And some patients look at the practice of medicine like they do anything else that they engage with. So they have a very high bar of expectations. And so it's really important for us to recognize that they are paying attention. And so, Brooke, I don't know if you have anything else you want to add about this statistic or some of the things we've talked about before, but I'd welcome you to chime in here.
Yeah, even though we work in healthcare tech, Jamie, like I always think here at Clara, like I'm a patient too. I'm a patient first. And I actually just had an experience back in October, establishing care with a new doctor. And I was absolutely taking note of things, probably also because I work here, but I was definitely taking notes of things that were cumbersome or redundant, or if I felt like I already filled out that paperwork. This also reminds me of a 2021 healthcare survey I saw of patients. It showed back then that they were willing to change providers based on if that provider offered texting or not. So thinking of it back then, that was a couple of years ago, it just shows how much our expectations and patient expectations keep changing and evolving over the years.
Yeah, for sure. That whole convenience play is critically important. And I know I feel it as a consumer and as a patient. And so I definitely understand that sentiment. Thanks for sharing that. So let's dig a little bit deeper and see what patients do really want and what they're thinking about. So as you might expect, and as we've talked about a little bit, you have different patients that have different expectations overall. And then as well as you think about the healthcare journey, and patients have unique preferences at each stage of the journey. So one person may want to pick up the phone and make sure that they have a conversation about scheduling, but they want automated reminders. They want reminders in email and text, right? They may want to have a video visit, or they may be against that, right? And all of these points along that customer continuum, that care continuum, are important to understand, and also have optionality in terms of being able to deliver the right message to the right patient when they are expecting it, and when you, within the medical practice, need to communicate there. So let's start thinking about the early stage of that patient journey and thinking about attracting patients. Here's a couple of statistics that jumped out to me when we started putting this together. And then practices have a chance of making a great first impression. So 1 out of 3 patients prefer to visit a practice's website prior to an appointment. 69% place an importance on the availability of a modern looking website, which I thought was interesting, right? You think about, oh, I have a website, I'm good to go. But actually the bar is getting higher every day, trying to understand what it is that they're looking for. They're looking for something a little bit more contemporary. Is it providing the information in the way that they expect to see it? And then lastly, and this is this one's not surprising to me, although the first statistic is quite surprising to me, quite frankly, which is 74% place importance on online reviews when selecting a new doctor. So of course, your ratings are critically important, understanding your brand and managing your brand, not only in the general public and for new patients, but then also for your existing patients. And these are really very much top of mind. The thing that stood out to me, Brooke, was this 1 in 3 patients prefer to visit a practice's website prior to their appointment. Now, my guess is that this is of all patients. And if you're already a patient of a practice, there's no need for you to go back to the website. But if we slice this a little bit more finely and looked at the people that were looking for a new provider, that statistic might go up. So I thought this was super interesting. It really highlights the importance of staying on top of things, right? It's easy to set it and forget it, but particularly in these digital communication platforms and tools that evolve so quickly, it really is important to make sure you're asking yourselves the question about where am I at relative to what our patients want. So I think this is another one, Brooke, that I'd just ask you, what stood out to you in these, and do you have anything else that you want to share?
Yeah, I'm probably opposite you. I feel, especially the website, maybe it's because I work in marketing, we've got a little different role. I'm always looking at websites and really judging brands and the quality that that brand can deliver based on what their online presence looks like. The online review part isn't super, I think it's in line with everything else. I know how much research I do just if I'm going out to dinner with friends, and that's just for one meal, let alone who's taking care of my health and longevity. So I definitely think we're seeing a rise there for sure. Going back to just building rapport behind that with your website, there's something called a 2x4 rule. So it's the impression you make on someone within the first 2 seconds. It actually takes 4 minutes to counteract that first impression. So when you think about that in terms of your website, if they can't find the information that they're looking for right away, or if it's super clunky, hard to navigate, looks outdated, isn't modern, as we're saying here, that impression just becomes an uphill battle from here on out. So just something to consider and thinking about moving forward.
That's right. When you're on a digital platform, abandonment is only one quick click away. So that's a really good point. Great. Okay, thanks for that. So providing a great experience is how your patients become your champions, right? And so one of the tricks is to make sure that we're reaching out and collecting feedback and then acknowledging for patients that are satisfied or dissatisfied that we're always in touch. We're giving them the ability to give us feedback and to learn on an ongoing basis. So as you're thinking about within the work that you're doing within the practice, particularly for those folks that are on the phone, asking these questions can help you evaluate your effectiveness in attracting new patients. So, does my website provide all the information a new and existing patient would need? Do you reply to or comment back on your online reviews? You have to be an active participant in your reputation management is a way that we talk about it within the industry. Do you have automated processes to generate online reviews? So as that patient walks out of the practice, are you automatically sending an opportunity for review? And then do you send surveys after appointments? All of these are a good checklist to say, if you're doing these things, great. If you're not doing them, what are your opportunities to look for ways to solve that? Obviously, because we're hosting this webinar, Clara helps you with all of those things. But just more broadly, as you think about taking stock of where you stand, this is an important area to look at. So, Brooke, I'll just pause there and say, is there anything else you want to add to that one?
If we go back to our John persona, I actually hear a lot from our clients as we're working on case studies and digging into, where they're finding value in Clara. I think we hear a lot from practices that John, our 64-year-old retiree, like, oh, my patient base, they're not super tech savvy. But if we think about John, he's got grandkids that he's probably communicating with, sending photos to his kids when he's watching them. They're actually becoming a lot more tech savvy in this population as they age, based in proximity, based on communicating with their family. So maybe not like in our traditional sense of work, but also I think of people in my life that are around that age and they're on social media. They know how to send Facebook messages. It's a very similar way of communicating, similar to your, I think you said 95-year-old, was it, who is in your life? Yeah. I have
that's right.
My grandma turned 87 last week, and she, we FaceTimed on her birthday. She knows how to use that technology as well. So as time goes on, I think we have this perception of patients and what they prefer. And I would just encourage you to open up your minds and your eyes to people in your life around those ages as well and how they're using technology.
Yeah, that's a great point. Thanks for that. Okay, so let's move on. So communication in healthcare, as we all know, and you just sit in a practice and you listen to the phones ringing and the faxes running and all that sort of thing, is that the connection between patients and providers and specialists is multi-threaded and multifaceted. And this spaghetti chart, this is one of my favorite charts that really in my experience, when I pick up the phone and call my provider and I have to leave a voicemail, and I have to wait for them to get back to me, and then I try to reach them, but maybe I'm busy and I can't make that happen, and so maybe I'll try to send an email. And needless to say, it is complicated, and there's lots of channels and there's lots of preferences. And then when you think about putting into the rest of the care team, so whether it's the pharmacist or the specialist, that there's a lot of channels of communication, there's a lot of delays, and I think that when we think about some of the challenges that we see in medical practices is burnout, staff getting frustrated, patients getting frustrated. And so this is the reality of our life today. And so we at Clara try to come up with a solution that helps address some of these most critical issues that we are facing. And so another poll for you. So I don't want to presuppose what is important to you. So I'd love for the attendees of this webinar today to give us a little bit of feedback. And what are the top challenges that you're facing in managing communication with patients today? And you can see the options here. Is it keeping up with the phones? Is it sorting and prioritizing conversations? Is it like an inventory system where first in, first out, or maybe it's the one that with the highest level of acuity? The quality of communication from staff to patients. I talked to a customer the other day, and they said they never liked to put their frontline people, particularly who are new to the practice, on the front lines of engaging with patients because they weren't really sure they were trained well enough. Is it the ability to respond quickly, or is it managing, as we just talked about, this multiple channels, such phone and email and text and the portal, or is it something else? So I'd love to get some thoughts here, because this will help us guide our discussion a little bit for the rest of the day. It's hard to choose. These are all, real problems. So it's tough to choose between these, because in our experience in working with practices, it's usually a couple. Let's see if we can get up to 50%. All right, let's see where we got to. All right, keeping up with the phones. Yeah, that's usually one that is amazingly challenging, and then responding quickly. So, relatively small sample size here, but we too feel and see that keeping up with the phones is important. And in all honesty, that's good to hear, because Clara has a solution to help you keep up with the phones that we'll talk about in a little bit, and we know that that is a real pain point. And when the company was founded 13 years ago, that was the first problem that they set out to solve, is how do you solve the phone problem? And then how do you how do we position ourselves to meet the needs of patients that want text-based messaging and other channel communications? Responding quickly is really a challenge, obviously, right? Because you want to make sure that you're getting to them as fast as possible and you're not getting into this voicemail tag. So Brooke, anything to add here?
I would say those are the top two I hear from customers as well. And the top two also, I will, on the plus side, say that Clara has helped them with when we talk about their success and where they're at to where they were. Definitely the phone problem, and then responsiveness. Great.
Okay, so let's look at some other statistics that we have here. So patients expect to communicate throughout the entire experience. So a couple of these interesting statistics. So 68% of responders agree that it's frustrating to leave a voicemail and wait to be called back. So I'm definitely part of that 68%. That stands true for me. 47% prefer email or text to an online portal for follow-up communication. So I too fall in that category. I know that my wife prefers to work in the portal exclusively, but that's not convenient enough for me. It's also not timely enough for me. And then 60% are more likely to use chat over calling to request lab results. So again, it's about convenience, it's about timeliness, it's about meeting patients at the point that they are at. And I think that that's incredibly important too. So Brooke, you spend a lot of time thinking about this topic. So anything else stand out to you that's worth noting here?
Yeah, I think on top of like leaving a voicemail and waiting to be called back, then there's that other flip side where you're getting a phone call and you can't answer it on the fly, and then you have the voicemail and you have to reply and call them back. I think that endless loop just absolutely drives me insane. Just to be blunt, with my time, with the practice's time, there's got to be a better, more efficient way.
Right. Great. Thank you for that. Okay, so we drew the spaghetti diagram earlier, and this is sort of how we look at Clara and the solution that we provide. So these are the same groups we have our patients, we have our specialists, our pharmacy, and obviously the providers and the practice staff. And so our vision for Clara is to consolidate all those communication channels into one communication hub that provides you as the provider and the practice staff the ability to see all those communications at a patient-centric level, to be able to sort through those by type of interaction and request, to route those internally within the practice if it's something that the front desk can't answer, et cetera, and really allow people to have the ability to communicate in their channel of choice, but then also give you the ability to respond in the channel that makes the most sense and keep everything in one place. And this is really the nexus of what we set out to solve in the way that we designed Clara. So you see a little bit more of that in the subsequent slides. So what is that? How does that really come to life? So our goal is to provide patients with the channels, access to the channels that they prefer to communicate. So if a customer, starting on the left-hand side here, if a customer has a preference for starting with a phone call, we actually give that patient the ability to eventually leave a voicemail if they want to. But equally, if they were unaware that you have the ability to text them, we can have them press 1 for text, and we drop them right into a text dialogue. So for all of those 40% of you that said that phone was a big challenge, we're offloading a whole load of inbound call volume directly before it even hits your front desk. So that's a huge win for us, and it turns a phone call into a text message, and that gives you the ability to handle more. Obviously, texting is critically important, and our platform works just like you would a natural text message, so it's very natural. We also give you the ability to have web messenger, so we put a little widget on the website that gives patients that are on the web the ability to message to you directly. Again, all of these things funnel into one platform, into one dashboard of communication, so you're not needing to look at the phone log, look at your cell phone for texting, et cetera. Everything's coming together. We give you a really nice desktop application and mobile app that you can use in order to manage that dialogue. If a customer decides to leave a voicemail, they're able to leave that voicemail. We transcribe that into text, and we give that right back to you. It's much faster to read what a voicemail is as opposed to have to listen to it. And so there too, if they give you the permission, we can also respond via text if we have that permission from them, or at least we can figure out how to prioritize it. And then lastly, of course, some people provide email, and we do provide the ability to interact and engage with customers via email. Our primary orientation is around texting, because our research tells us that most people like that as a primary, but we also have these other channels of communication as well. So Brooke, I think I've done an okay job describing it, but I welcome you to chime in here and see what else you'd like to highlight that would make sense for our audience.
Yeah, you did great. I mean, I feel like this voicemail is just top of mind as a big pain point, maybe just for me. But how many times have you listened to a voicemail just to hear that one section that you missed, that you need to re-listen to get that one section again? And I think the transcription and just being able to fast forward and listen to, is it the date of birth? Is it the phone number? Is it, whatever information you need out of that call? I think the voicemail transcription is just game changer. I use it on my iPhone all the time, so I don't have to keep re-listening to voicemails, or I thought it was a spam call calling, and then, it transcribes it. I know exactly what's said there.
Great. Perfect. Thank you. Okay. So this is a quick view on what that voicemail transcription looks like. We don't need to spend a lot of time on that, but you can see that this is your dashboard, and when you see that transcription come in, you can quickly glance at it and figure out what makes the most sense in terms of how to follow up. Equally, when you start looking at the centralized panel of communication, this is all patient-centric. So the nice thing is you have an entire thread with that patient over time. You understand initial inquiry and responses and back and forth. So that's very nicely packaged in order for you to manage and understand. So that's a huge convenience for our customers. And then when you think of taking a step back and you think about, okay, so how are we doing within the practice to evaluating your own effectiveness in terms of connecting with patients on their terms? So are you enabling patients with digital forms of communication, such as text or web chat? How much time do you spend calling customers each day and responding to phone calls? It's surprising if you spent a day just sort of doing a little checklist on the number of minutes or number of calls that were made. You might be surprised if you're not running those reports out of your phone system. During peak hours, what's the whole time that patients are calling in on, and are you tracking those metrics and seeing how good you're doing or maybe what the opportunity is? At which stage is communication more effective and which is least effective? So are you getting to the phones on time? Are you responding on time? What are your patients telling you? And then have you considered a mystery shopper approach so that you can instruct your practice and your staff around how things are going? So you can have people call in and try to make an appointment and see what that time is like. And that whole concept of mystery shopping in the dark ages, I used to be in the retail business, and we would go mystery shopping of our own stores. And it's quite interesting what you learn and how valuable that is. One of our physicians that are on staff with us at Clara really invested a lot in his practice to do mystery shopping of that overall patient experience. And he found it incredibly helpful to give that feedback to his staff. And they used that feedback in order to plan what else they need to do in order to work more effectively. So let's think about retaining patients. So a couple more statistics for you here. So when we think about what patients expect and then keeping patients coming back. So interestingly enough, 60% of respondents are likely to select one doctor over another if they have online booking. Sometimes we make the assumption that everyone acts like we do, and we don't think that that's a priority, but for a majority of patients, it is. Interestingly enough, 42% of patients said that they left a practice because they waited too long. That means that's really in the waiting room. So if they have to wait too long, you're not able to communicate with them about if there's any delays, you're missing an opportunity and patients will walk out the door. That's tragic, of course. And then also when we think about that larger perspective, which is what about that patient experience, 30% of our respondents said that they have switched doctors to unfriendly staff. And it's probably not the staff members themselves, right? It's probably just the pressure that they're under. It's the constant frustration that patients are suffering from, and the work that we're seeing in the staff. And everyone's working hard, but it's easy to get frustrated. And so what are ways that we can make that not a particular issue for in the practice, and making sure that you're understanding what's happening here? So Brooke, anything to add on this particular set of findings?
Yeah, I know a lot of times when our customer success team is talking with practices, they're really surprised at that 60% stat. I think that's the one that they're most shocked about. I think the 1 out of 3 patients leaving their doctor because of unfriendly staff is a little less surprising. So yeah, a little mixed bag here of what stands out. Yep. For sure.
Yep, great, okay. Great, so how does Clara help solve that problem? So obviously, anytime that you can divert a phone call into a digital channel of communication, that's gonna be better for you in the practice, and it's gonna be better for the patient. So the Clara platform enables you to do scheduling via text, and that makes it super easy. And so not only are you able to pick your appointment slots, but you also get a quick acknowledgement of such. Obviously, appointment reminders are critical. That's sort of table stakes, I guess I would say. But those streamlining that process of appointment reminders, and not only giving you the ability to do it, but from an automated or a customer journey perspective, that's another part of the Clara platform that we get great feedback on, and that is important for patients to meet the needs that they've already told us that they care about. Reducing those in-office waiting times. So what can we do to do that? We can make sure that we are collecting information from the patient as they are sitting there before they show up. Providing pre-visit instructions, so this can be delivered on an automated basis. So once that appointment is scheduled and that reminder is out, you can also follow that up with a templated communication that enables you to provide the right instructions. In this particular case, we talk about parking instructions, which is helpful, and then also providing the patient intake form, which can be filled out before they arrive. And then generally, as you take a step back, again, and thinking about how am I doing against these, you can ask yourselves, how much time do patients spend in the waiting room in the exam room? Do you provide pre-appointment check-in capabilities? Do you provide automated appointment reminders via text or email or phone? And how do you make that happen? And then does your staff receive customer service training? This was actually a really interesting question. Another one of our medical directors, also who was very committed to his patient experience, spent time. It was related to the story I told earlier about the mystery shopper, but really making sure that we all understand that while we are in the medical business, we're also in the customer service business. So how can we arm our team with the right information to enable them to respond to irate customers and to handle tense situations and really just be a better partner to our patients, and it feels like we're providing the right level of support within the practice as well. So we get great feedback from our customers. This was a great piece of feedback that we got that said that Clara helped change the atmosphere in our office. As opposed to everyone being frustrated, scrambling around, trying to answer the phone, it was we save time. We take work off your plate. We automate a lot of the things that does not need to require manual work. And so that actually helped this particular practice have more time to help the patients in the office and feel a little bit less harried. And so that's our goal. Our goal is to make your lives easier while you're improving the engagement that you have with your patients. Okay, so let's work towards how do we keep patients engaged as we move through this life cycle. So does the technology you implement help improve the quality of care? So interesting question here. So 92% of patients agree that their doctors seem more attentive since introducing new technologies in their office. And I thought that was really interesting, is that, obviously they care about that care experience, but when they look around and they think about what are the things that are allowing the providers to be more attentive, and it really speaks to a little bit about what we talked about earlier, is that when you have technology that helps relieve work and remove work from your day-to-day life, it gives you more time to focus on the patient. So this is a little pot of gold right here, is that if you can actually effectively deploy technology and process improvements and training, your patient population will see that, and it can make a difference to them. So Brooke, I see you nodding there, and I think that you're passionate about this one. So what do you have for us here?
Just like breaking my neck with a nod. Yeah, I think we think about it anywhere, right? Like any place you go, anytime you receive great care, anytime someone's super attentive, like I can't tell you how many times I've recommended something to friends based on the service. And I don't see that happen as often in healthcare. I think we hear a lot more negative stories about like something bad that happened, or like when I went to the dentist last week, they just didn't have time for me, even though it was my appointment time. I think we hear the bad stories, and it's just so positive, the outlook here, that something just as introducing a new technology and something just as giving the tool for the practice and for the staff to be more attentive, that can be what switches and changes the game here. I think you're on mute there, Jamie.
Okay, thank you for that. So one of the interesting things in terms of sort of managing, we talked about it a little bit earlier, but you imagine all of the inbound questions that are coming in, they don't need to go through one person, right? Even though there's this triage concept. The nice thing, you think about how do you solve that from just a general workflow efficiency standpoint. You want to get the message to the person who can answer that question as fast as possible. And so one of the things that we are able to do as part of Clara, and it begins to sort of tap into some of our heritage in terms of leveraging advanced technology like machine learning and AI, is that we are able, because we are interpreting the message on the way in, we are able to give you the ability to route that message directly to the right team in order to handle that. So that means you take one more step out of the equation. Additionally, if that doesn't apply, the person who receives the first message, as opposed to needing to pick up the phone, call somebody else in the practice and say, hey, I've got a question, can you answer this? You can immediately use our software in order to route that message to the right person so that they can respond directly to the patient. Now that is a game changer for a lot of practices, because that message can be waiting for the person in billing or the clinical staff or in scheduling. And really, based on the nature of the message, whether it's a voicemail, whether it's an inbound text message, whatever that may be coming into the Clara platform, we're able to auto route that and give you the ability to address that down the line. So that's incredibly powerful. And to the extent that any of this is interesting and you'd like to learn more, of course, we'd love to have an opportunity to show you how Clara works in terms of showing you a demo and how it works well with Athena. This is a game changer for efficient workflow within the practice. We also have the ability to re-engage patients. So not only can we engage patients when they're reaching to us directly, but we can also reach out to them if they've missed an appointment or if it's a recall just generally. We can set up automated cadences and journeys in order to reach out to those patients to re-engage them, again, via the channel of their choice. This particularly happens to be a text message, so that's another advantage where you don't have to pick up the phone and try to call them. They don't have to call you back. You can just send a note directly to them. So again, taking a step back, ask yourself these questions as you're thinking about where you stand. How do you use technology today? Are you using a tablet to take notes and review patient history? Do you use electronic prescription services? Can patients access test results online? Can patients send a message to their doctor? And then can patients make payments online? Payments is a huge opportunity, right? If you can not only handle copays up front, but then also make sure if there's outstanding balances, you can follow up on that. These are all the things that when you think about giving yourself an assessment of where are your biggest opportunities within the practice, these are some of the things that absolutely make sense for you to consider. So how do we start giving patients what they really want? So it starts by streamlining all patient interactions within the care journey. So we've just spent a lot of time today talking about what that care journey is, what the preferences are, what we learn from patients in terms of their preferences, and then also Clara, we're very fortunate to have an amazing platform that helps us do that. Also making sure that you're choosing partners that can interoperate. So we are an open platform. athenahealth has a great platform for managing medical records and billing. And Clara has a great solution for managing patient communication. We work very closely with Athena to integrate with the Athena platform and give you the leverage that you can. And so we are proud to be in a partner of Athena, and we value the relationship that we have with them. And I'm not going to read this, you can see it for yourself, but when we do that well, and when practices are committed to changing the way that they work, it really relieves an immense amount of stress in the practice, and it saves time, and it more effectively engages patients. And so these are the types of solutions that we love to deliver. And when our customers feel like we're winning, then their patients are winning, and we feel like we've done a good job for the day. And we never stop working to try to make that experience as good as possible. So with that being said, almost exactly on time, that never happens, but almost exactly on time, we are at the point of questions. And so I'm going to take a look in the little Q&A box here and see if we have what we have in here, and I'm happy to answer those. And let's see, we got a couple here, so thank you for that. All right, so I'm going to pick this first one, which is, let me just just read this here. Okay, so the question here is, while obtaining best patient outcomes as well as value-added care and affordability, how do we balance personalization with the need for the standardization of care? That's a great question and a deep question, and I would say that personalization is important, but obviously there are standards of care that we need to adhere to, right? And that is probably first and foremost the priority that you would place, and that the balance is really how can you make sure that you are delivering the messaging and communication to your patients that will achieve the best outcomes, make sure that it is in fact aligned with the standard of care, but then also that it's relatable to the patient. And so really understanding who your patient is, making sure that those communications, at least as it's enabled by Clara, is that it meets the standard of care, but then also as you're delivering that message, if it's direct from a provider to a patient, that it incorporates the nuance about how you understand that patient, right? And so it's setting context. Only so much can be done in a digital channel, but in a invitation for a follow-up or a consult, that gives you the ability to do that. And in many of these cases, some of the journeys that we're able to put together for you that are aligned with the standard of care, and then also the way in which you want to communicate with your patients, it enables you to achieve that minimum required communication to the patient, but then also put some top spin on it that is nuanced and appropriate to either the patient situation or the way in which your practice decides to handle things. So hopefully that answers your question, Carol, and thank you for that. And then another question, so it says, how can you make communication feel human when you're communicating with patients in a digital platform? That's a good one. I think the starting point for me, quite frankly, is what is it that you're trying to say, and what is the voice of the practice? So if you think about, we all spend a little bit of time thinking about personal branding, and we think about practice branding. What is the essence of the communication and style of communication that we want to convey? And as we're writing those digital communications, making sure that it is being true to the way that you want to come across as a practice. Just because it's digital doesn't mean that it feels robotic, right? There is, with our customer success teams and our implementation teams, we can give you some starter content that helps you get there. I think the other thing, and this is a little bit for me because I also have a marketing background, is that talk to your patients when you are doing an outbound communication with them. Ask them when they come into the office, tell me a little bit about your experience in the communications from our practice. And ask them questions that is aligned with the way that you want your practice to be perceived. And if that patient comes back with a response that feels like they have heard you the way that you want to talk, then you're doing a great job. If they come back and say, it felt too technical, it didn't feel like you understood me, or it felt like I was a number, then that gives you the opportunity in order to tune that communication a little bit to be more appropriate. And I think the lesson in my view and in discussions that I've had with providers that are customers of ours, you have to listen to that customer. And in order to listen to that customer, you want to ask them what they think. And sometimes that's a little scary, particularly in the medical space. But I would say that your customers are your best gauge on how you're coming across.
Can I add to that one a little bit, Jamie?
Sure, yeah, please do.
Yeah, I think we've all gotten those messages before where it's like, it won't even say hi, right? It'll say, your appointment is tomorrow at 2 p.m. at my medical practice. And you're like, okay, versus what we can actually do with some of those automated appointment reminders is we can set them to talk and to sound like you're talking to a person. So here's the difference, right? Your appointment is tomorrow at 2 p.m. at my medical practice versus, hey, Jamie, we're looking forward to seeing you tomorrow. A reminder, our practice is located, on the 3rd floor of this building, and here's the parking lot information. It's at 2 p.m. Just a reminder not to eat or drink anything. Please, please let us know if you have any questions. We look forward to seeing you. You can see how the difference, even though that's an automated standard message, that the difference in it makes you actually feel like you're being cared for versus see you tomorrow at 2. For what? Why am I seeing you?
Put a couple of drops of warmth in that communication and see how that goes. So I think that's great advice. And that one more question here I think we have time for, which is how do you effectively gather feedback from patients to better understand their needs and preferences? And so one thing to do is, and I know that there's a lot on the desk of the plate of the front desk folks, but you could give them a survey in the practice and ask them to give you feedback. You could have a conversation with them. There are also survey capabilities, that we have in Clara, but also you can have off the shelf as well, that would give you the ability to poll a certain group of customers and patients to get feedback, right? And it's fascinating. Sometimes we think about, the last thing we want to do is ask our patients to do yet one more thing. But feedback is a gift, as they say, and it turns out that patients and just consumers in general love to get feedback, and they actually feel more valued when you're asking their opinion. And I know that sounds a little pedantic for me to say that, but it is in fact true. And every time that I've always been afraid to ask, I'm always surprised at the number of really useful pieces of feedback that you get. So I'd encourage you, as part of your customer service training or part of a goal, is to get some customer feedback on a weekly basis. Set a goal for a couple of pieces of feedback from patients, and see what you get, and share that, and have conversations within the practice in terms of understanding, what does that mean for us, and are we actually living the values that we set out to live, and are we delivering a experience to our patients that we are wishing them to have. So all of those things are super important. So those are great questions. I really appreciate you all teeing those up. Just a couple of things. So one is, if you're interested, you can assess your practice in a 2-minute patient experience quiz. And so based on that, you'll receive a personalized action plan. So some of these questions might look familiar to what we talked about earlier, but that's something you'll have an opportunity to do. And I encourage you to do that and share that with your colleagues. Second of all is the actual patient experience report. So Brooke, I'm gonna sort of turn you over to merchandise this a little bit. We talked about it earlier, but what do you have to say for folks about the patient experience report?
I think the patient experience report has just so many insights that people have just changed. The climate has changed. If we even just think about what, COVID-19 did to patient perceptions, and there's, is there fear with going to the doctor? Is telemed still a thing? How do people want you to communicate with them, and how are they expecting it back? It's just changed quite a bit, just given everything else going on. And it's a really insightful piece, and I think you'll learn a lot. And it's really nice to tie that report in with your quiz. So it's like, okay, how am I doing? And then the report is to help fill in some of those gaps and really make it a nice package for you.
Great. Okay, thanks for that. All right, and I did see a couple of late-breaking questions that came in, and what we'll do is we'll follow up with you directly to the extent that we can do so that we can address your questions. And so thank you for those additional questions. So let's think about the plan of action going forward. So would you like Clara to reach out and set up a personalized demo? So if you had some specific questions about how we work with Athena, if you saw some things in here that were interesting to you that you just want to learn more about, if you'd like to compare us to other solutions that you're looking at, we would welcome that opportunity. And so please take an opportunity to let us know here, or there'll be some information and follow-ups that you're welcome to provide to us. We'd love the opportunity to speak with you and give you a little bit more hands-on view about what Clara could do for your practice and how it could help you. And I hope that on today's webinar, you actually have gotten some learnings, gotten some insight that you didn't have before, and that you will reach out, because we'd love to have an opportunity to talk to you. And with that said, I'm going to flip over to the closing slide. And Brooke, I'm going to hand it back to you to bring us home. And for everybody on the phone, thanks so much for joining us. If you have feedback for us, we'd love to hear that from you. And all yours, Brooke.
Awesome. So now that we're at the end of the session, I just want to say another big thank you for everybody for your time, for listening to our webinar, everyone in attendance for joining us, everyone on the recording later. If you are interested in learning more about Clara and how we can help your practice streamline communication and engagement with your patients, you can send an email to hello@clara.com and we will follow up with you. There'll also be some other communications. So if you didn't get the email, no worries, we'll get you another way. And once again, just thanks for attending, and we hope to see you at another webinar soon. Hope you all have a great day.